Hi everyone. Today let's talk about the summary of tympanograms. Yesterday we did the entire presentation of impedance audiometry, but I thought if we can put it in a like a table, we can remember it easily. Okay. So just a revision. What is type A? Type A is normal. This is type A. Okay. This is type A. Type A is seen in normal middle ears. There is no problem. There is no pathology. Nothing. What is the compliance? Compliance is basically the ease of mobility of the tympanic membrane. Ease of mobility of the tympanic membrane is normal. Okay. And what is the middle ear pressure? Middle ear pressure is normal because the eustachian tube function is normal. So you'll have the peak there's a normal peak at atmospheric pressure. Okay. So that is the normal type. Now with this normal type, we'll be comparing the others. What is type AS? The subscript S stands for stiffness of the tympano-ossicular system. What are the diseases? You see this? You will see this in otosclerosis and tympanosclerosis. Okay, any kind of ossicular fixation pathologies. Because the ossicles cannot move properly, what happens to the ease of mobility of the tympanic membrane? Ease of mobility of the tympanic membrane is decreased. Okay, this is understood. Ease of mobility of the tympanic membrane is decreased. But what happens in otosclerosis and tympanosclerosis? Is there any problem with the eustachian tube function? No. Eustachian tube function is normal. So the middle ear pressure will be normal. Okay. In such a case, you will have a peak, but the peak will not be able to reach till the normal. That is because the compliance is decreased. Compliance is the ease of mobility is decreased. So it is able to move, but it is decreased. It is not able to reach the peak of the normal A curve, but you are able to reach it at the normal atmospheric pressure because the eustachian tube function is normal, middle ear pressure is normal. Okay, so peak is at lesser height than normal, but at atmospheric pressure. Type AD. D stands for discontinuity. D stands for discontinuity. Name suggests there is some discontinuity in the ossicles. Okay, there is no incus, or there is no malleus, or there is something. One of the three is gone. Okay, this happens in one of the head injuries, or it may be happening in some kind of CSOM also, but mostly in head injuries. Okay, there is some kind of ossicular dislocation. Okay, it's also seen in thin and lax tympanic membrane. I have wantedly put the disease or pathology in the beginning so that when you remember stiffness, you should think of otosclerosis and tympanosclerosis. When you think of discontinuity, you think of ossicular dislocation and thin and lax tympanic membrane. Now you see what happens to the compliance in ossicular dislocation. Because there is no resistance, whatever minimum or normal resistance of the tympano-ossicular system, that resistance is also gone. So the compliance, the ease of mobility of that tympanic membrane and the ossicular system, tympano-ossicular system, is increased. Okay, so the ease of mobility is increased. Do we have any problem with the eustachian tube in ossicular dislocation and thin and lax tympanic membrane? No. So the middle ear pressure will be normal. So what do we have? We have a peak, but it is at a greater height than normal, but at normal atmospheric pressure. So this is the AD curve. It goes up at one point. It's going to touch each other, but yeah, this is the AD curve. Okay, so there is increased compliance, increased ease of mobility of the tympanic membrane at atmospheric pressure only, but higher than normal. Okay, so this is because of the ossicular discontinuity or ossicular dislocation. Now comes to type C. This is where usually we get confused. Type C stands for closure. C stands for closure. This is seen in early stages of serous otitis media. The important point which will help you to come up with the right kind of compliance and middle ear is that there is only air, but there is no fluid. The eustachian tube has just got blocked, okay, but the fluid has not yet started to collect in the middle ear. Because there is air in the middle ear, only air, there is nothing stopping the ease of mobility of the tympanic membrane. Okay, so here, as we said, the problem is with the ossicles and the eustachian tube is normal. Here the problem is with the eustachian tube and the ossicles and the middle ear. The environment, you can say, the ambience or the environment of the middle ear is normal. So there is only, actually there is always air in the middle ear. In here also there is air in the middle ear. Because there is air in the middle ear, there the tympanomuscular system ease of mobility is normal. So okay, so it will not be decreased here, it is normal. Okay, because there is only air in the middle ear, fluid has not yet started to collect. Early stage of serous otitis media, the exact pathology is the blockade of the tympanic membrane, so the negative middle ear pressure is there. So we will be able to get the peak. The ease of mobility of the tympanic membrane is there, but you will be able to reach it at a negative middle ear pressure. So this is at the same level. This is at the same level. This is the same level as that of the A curve. This is the same level as that of the A curve. But to reach it, you have to come to negative middle ear pressure of 200 mm water. Okay, if you can come to negative middle ear pressure of 200 mm water, then you can get the normal peak. Okay, so the peak is there and the peak is normal. Peak is not decreased. Peak is normal, and you will be able, but you have to go to negative minus 200 mm to reach it. Okay, so C stands for closure. Early stages of serous otitis media, there is only air, there is no fluid, so the tympanomuscular system ease of mobility, compliance is normal, but you will be reaching it at a negative middle ear pressure. Okay, type B is blocked. This is like straightforward. Okay, closure is somewhere that usually we get confused. Type B stands for blocked, C stands for closure, B stands for blocked. This is in the late or the middle stages, or usually how the patient presents to you. No patient will present to you in closure. Okay, there is very rarely you will probably present with closure, but most of the patients will present to you in blocked tympanic, blocked or type B level. Most of the cases that we see in our day-to-day practice is also blocked only. Late stages of serous otitis media, fluid and air is present in the middle ear. How it appears. So this is the tympanic membrane and there is a air fluid level here. This is filled with pus or something, and there is fluid, there is air above, or there may be air bubbles also. This is usually the presentation in serous otitis media. So what happens, because there is fluid behind the tympanic membrane, can the ossicles move easily? Can the tympanic membrane move easily? No, tympanic membrane will not be able to move easily. So what happens to the compliance? Compliance is decreased. So this is where the compliance becomes decreased, because there is fluid in the middle ear. Obviously, yes, there is definitely negative middle ear pressure. You will not get a peak at all. In this, you will not get a peak at all. You will be getting a dome-shaped curve. Okay, you will be getting a dome-shaped curve. But if you observe the peak of the dome is at approximately 200 or 300, in between 200 or 300 mm of water. So it is not flat. There is a dome. There is compliance is there, but it is decreased and it is falling down. Okay. So there is compliance is there, but you do not have a peak. There is no peak at all. But you find a dome-shaped curve. B means dome-shaped curve. Now that is something you have to remember. Serous otitis media, dome-shaped curve. Okay, dome-shaped curve. Compliance is decreased. Middle ear pressure is decreased. The height of the dome is greater minus 300. Okay, so B stands for blocked. C stands for closure. In between these two, do not get confused, because here in closure there is only air in the middle ear. In type B there is air and fluid. Now these are the basically 5 types that we usually talk about: type A, type AS, type D, type C and type B. Okay, so these are the usual things. Type F is also there, but usually we don't talk about it, but I am putting it here because for completion's sake. Okay, type F, I don't know whether you can call it F or not, but there is something called a flat curve. Okay, it's seen in chronic stages of serous otitis media where the middle ear is totally filled with fluid, absolutely no air. So obviously the compliance will be decreased and there is negative middle ear pressure, and you will have a flat kind of a curve like this. Okay, you have a flat kind of a curve. Flat kind of a curve also indicates tympanic membrane perforation. Okay, type C, let us basically focus saying that it's early stages of serous otitis media. If you can remember that, you can see the same kind of findings in retraction of the tympanic membrane. Fine. Okay, I hope if there are any doubts, we have cleared up with this chart. So type A, normal. Type AS, compliance is decreased, eustachian tube is normal. AD, compliance is increased, eustachian tube is normal. middle ear pressure is normal. Type C, compliance is normal. Compliance is normal, but there is negative middle ear pressure. And type B, compliance is decreased and there is negative middle ear pressure. Flat curve also, compliance is decreased and there is decreased middle ear pressure. Type C, you have a dome shaped curve. Type B, type C, you have a peak, but you will find it at minus 200 mm water at negative pressure. Because there is air, only air, no fluid, you will have a peak. In type B, there is no peak, you will have a dome shaped curve, and type F, there is a flat kind of a curve. Okay, I hope it is clear, but you will need to revise it so that you can remember it, because this is like an eternally confusing topic. Thank you.